Thank you for watching the video. This is YouTube Medical University. This time we have a complete video that covers everything about dementia. By 2025 it is said that 1 in 5 people over the age of 60 will develop dementia. In other words, if we can't prevent dementia in 20% of people or miss the early symptoms, it may progress further and make it difficult to live life as yourself. I think many people are worried about this. So this time, what kind of illness is dementia? What are the early warning signs? And is it really possible to prevent dementia? Also, the treatment methods for dementia, the latest treatments. What kinds of treatments are available? And finally, I want everyone who may be involved with dementia to know this. Dementia is actually this kind of illness. If you interact with people this way, they can live a lively and healthy life. I would like to explain these things from a doctor's perspective. I provide community health care at Hokkaido City Central Hospital. I do home visits, inpatient care and outpatient care. While diagnosing and treating dementia, I also give lectures and provide guidance on care. Today's video is a bit long, but I've packed it with really important things I want to share, so I'd be happy if you could watch until the end. And if this video is even a little bit helpful to you, it will motivate me to make the next one, so please, I'd be happy if you could subscribe to the channel. Here at YouTube Medical University, I share information from a doctor's perspective about early detection of diseases and preventive knowledge. Hospitals, by their structure, receive medical fees for diagnosing and treating illnesses. Even if knowledge about not getting sick is spread, it doesn't benefit hospitals much. However, what's important is that while treating illnesses is important, early detection and prevention, in other words, stopping diseases before they develop, is also crucial, isn't it? I'm sharing these videos to convey a message. Let's learn together. Here's today's agenda. First, in the first section, we'll talk about what kind of illness dementia is. Next, we'll look at the early symptoms of dementia. Then I'll introduce a simple screening test to help determine whether someone might have dementia. In the fourth section, we'll discuss what kinds of treatments are available for dementia. In the fifth section, we'll talk about what you can do to prevent dementia. We'll also touch on the concept of mild cognitive impairment, which is the stage before dementia, and discuss effective ways to prevent dementia. I'll introduce just one dietary method. And in the sixth section, we'll discuss not only how to prevent dementia, but also how to live a vibrant life even if you develop dementia. We'll also talk about how society as a whole can change, not just at the individual level. I'll share my thoughts on whether such changes are necessary. And finally, in the seventh section, for everyone involved with dementia, I'll explain what kind of illness dementia is. By providing care in this way, even if someone has dementia, they can continue to live happily as themselves. I'd like to introduce 3 important principles of such essential care. Now, in the first session, I will explain what kind of illness dementia is. First, please take a look at this graph. This displays dementia rates by age group. Focus on the numbers in the center. There are numbers that jump up to 22%, 41%, and then 61%. These are actually the percentages of people with dementia. In the early 80s it's about 20%, in the late 80s it's double that at 40%, and by the 90s it's said that 60% of people have dementia. It's said that once you reach your 90s more than half of people have dementia, so even if you're confident that you'll never get it, the older you get, the risk of developing dementia increases. What kind of symptoms does dementia refer to? When you learn about it again, you realize, oh, that's what it is. When people think of dementia, they think of forgetting things. In the past, it was also called chihosho, senility. And I think some people remember it that way, but that's actually incorrect. People with dementia don't forget everything. There are 3 major types of impairments in dementia, so let's look at them one by one. The first is memory impairment, the second is disorientation, and the third is impairment of understanding and judgment. There are some difficult kanji here, but don't worry, it's simple. First, what is memory impairment? Memory isn't just about remembering. It can be divided into 3 stages. The ability to remember new things, and then what you have remembered, the ability to retain them over time, and finally the ability to recall what you have remembered from the drawers in your brain. These are the 3 stages. People with dementia have an impairment in just one of these abilities. So which of these, learning, retaining, or recalling, is impaired? It's the first one, learning or having difficulty remembering new things. So conversely, things that are not new, they can still retain and recall things they learned in the past. Haven't you experienced this too? Even people with dementia can have completely normal conversations, and when they talk about the past, they can share stories so enjoyably that you wouldn't even notice they have dementia. This is because dementia doesn't make you forget everything. It's true that they can't remember new things, but they can still enjoy talking about the past. Let's keep this in mind. The second one is called disorientation. Disorientation might sound like a difficult word, but it's actually simple. It refers to things like people, places, and time. Memory related to these things tends to decline easily. Because these things change a lot, they become easier to forget over time. In other words, since time is constantly changing, it becomes harder to know things like what month or day it is or what season it is. It also becomes difficult to recognize places. For example, you might not be able to go to places you recently visited, or when staying somewhere overnight you might not know where you are, or you might get lost. And as it progresses further, you may not be able to remember people, so you might not recognize family members you haven't seen in a while, and you may even forget the person who is always caring for you and by your side. Those kinds of things can happen. So, one of the changes that often occurs in the early stages of dementia is that people may not be able to choose clothes appropriate for the season. For example, wearing a very warm sweater in the summer, or wearing something quite thin when going out in the middle of winter and looking very cold. These kinds of symptoms might be. This could be something called disorientation. And the third is called impairment of understanding and judgment. The most common in Alzheimer's disease or Alzheimer's type dementia, the hippocampus, which controls memory, is affected, as well as the parietal lobe area. Memory of places, spatial memory, and the parts responsible for judging and understanding things are impaired, so it starts with being unable to do slightly more complicated tasks in daily life. For example, cooking. Cooking involves quite a complex process, doesn't it? You take out the ingredients, cut them, wash things in between, simmer in between, season the food, and then serve it on a plate. It becomes difficult to handle this series of various tasks, so in the early stages of dementia, it's common to see a reduced variety of dishes and the flavors becoming monotonous. Such changes might be signs of dementia. Not only that, but also with household appliances. It becomes harder to use things like electric kettles or rice cookers, and at the checkout when shopping, now there are self-checkout registers, but you might not be able to use the self-checkout. Also, things like buying tickets at the subway ticket machine, these kinds of complex daily activities become difficult. This too might be a sign. There may be a possibility that understanding and judgment abilities are impaired due to dementia, specifically in the parietal lobe. And when I'm seeing patients in the outpatient clinic, I often get asked, lately, I've been forgetting things more often. Doctor, could this be dementia? People get worried and ask me this. Whenever I'm asked like that, I always answer the same way. As long as you can ask me that question, you're fine. Why? Because you're able to recognize your own forgetfulness. In other words, when you say, "What was that thing called again?" and someone tells you, "Oh, it's this," and you respond, "Ah, yes, that's it," or things like that. Also, things like remembering what you had for dinner last night. For example, when you say, "What did I eat again?" and someone tells you, "What are you talking about?" You had fried shrimp, and you can respond, "Oh, that's right, it was fried shrimp." That means you understand and recognize your forgetfulness. However, people with dementia can't remember things in the first place, so even if they're told they can't recall it, that's because the memory is completely gone. Even if you tell them you had fried shrimp yesterday, they'll respond, "No, I didn't eat that." On the other hand, from their perspective, their wife is saying they ate fried shrimp yesterday when they didn't. They might even start to wonder if their wife ate it secretly, or if their wife is the one who's confused. In other words, everyone forgets things sometimes, but that kind of forgetfulness is just temporary. When someone reminds you, you remember and realize, "Oh, that's right." And with forgetfulness caused by dementia, the memory itself is completely gone, so even if someone tells you, it doesn't ring a bell at all. This makes it hard for the person to realize they've forgotten something. For example, as shown in this image, with normal forgetfulness, you might remember drinking miso soup yesterday but can't recall what ingredients were in it. But for someone with dementia, the entire memory is missing, so they might think they didn't drink miso soup at all yesterday. Let's understand it that way. Now, in this second period, as I've just mentioned, I'd like to introduce 6 carefully selected early symptoms of dementia, in addition to what we've already discussed. Here is the first of the 6 early symptoms of dementia, repeating the same thing over and over again. We often receive consultations about this. "Doctor, it's about my father. He asks the same question he just asked, and I end up answering him about once every hour. I start to get irritated too, and because I'm irritated, He gets irritated as well, and it's really troubling. But from the perspective of someone with dementia, when he asks, "Hey, isn't breakfast ready yet?" and I say, "You just had breakfast," even if he thinks, "Oh, is that so?" After another hour passes, he doesn't remember having breakfast or even asking the question, so he thinks, "Wait, come to think of it, I haven't had breakfast yet." And then he ends up asking again, "Hey, isn't breakfast ready yet?" over and over. If you say, "Yeah, you asked an hour ago and I told you that you already ate," he'll think, "Really? Are you sure?" He just doesn't know from his perspective. For that reason, repeating the same questions and similar behaviors is an early symptom of dementia. I'll talk about how to respond when you're asked the same thing over and over like this in the care section of the 7th period. Here is the second of the 6 early symptoms of dementia. It means that you start forgetting where you put things more often and end up looking for things a lot. Actually, I also lose things quite often, but this is different. It's when you forget things and look for them over and over again in a single day. This can simply be because with dementia, you can't remember things and end up losing them. When someone develops dementia, they lose the memory of where they put things, so it's easy to misplace items. When they find the lost item, they might think, "I shouldn't be losing things over something like this," or "I shouldn't trouble my family." Thinking that way, they end up putting things in places that only they understand or think are easy to remember. But because they hide things in places only they know, it becomes even harder to find them later, and they easily fall into a vicious cycle like that. Before they realize it, they think, "I'm sure I put it here, but it's gone," or "I thought I left it here, but it's missing." Since they don't remember hiding it themselves, they start to wonder if someone else took it. They may even begin to think that way. This is called paranoid delusion of theft. The name comes from the idea of imagining that things are being stolen. Personally, I don't like this term. That's because from their perspective, they tried to be careful and put things away. But then they forgot where they put them and the items are missing, so it's only natural for them to think someone must have taken them. It's not a delusion, but something that occurs naturally, so others should understand this. I'll discuss handling paranoid delusion of theft later. Here is the third of the 6 early symptoms of dementia. It means having trouble with things like cooking or shopping that they used to be able to do. I talked about this in the first part as well. When someone develops dementia, it becomes difficult for them to understand and make decisions. That's why they gradually become unable to do complicated tasks. In that sense, things like cooking and shopping become difficult. Here is the 4th of the 6 early symptoms of dementia. Their wallet becomes stuffed with coins. Isn't this surprising? Doesn't your wallet ever get stuffed with coins? For me, it often happens when I travel abroad. The reason for this is that when you go overseas, it's hard to tell which coin is worth how many cents or how many baht or how many dollars, right? So you end up using bills more often and your coins pile up. It's the same for people with dementia. When you're told the total is 512 yen at checkout, it becomes harder to calculate things like 5 100 yen coins and 1 10 yen coin. But people with dementia remember things from the past, right? And they have years of wisdom. Well, when they're told it's 512 yen, they know that if they just hand over a 1000 yen bill, the payment will go smoothly. So rather than struggling to calculate the coins and feeling embarrassed, they realize it's easier to just pay with a bill and get it over with. As a result, they end up using bills more often and their wallets get stuffed with coins. So if you notice your family member's wallet is full of coins, it could be a sign of dementia. Here is the 5th early symptom of dementia: losing motivation and no longer going out. As dementia progresses, they start to wonder, is there something wrong with me? Because of that feeling, they don't want anyone to notice and they don't want to trouble anyone. Because of those feelings, going out becomes a hassle. Even if they do go out, things often don't go well. And when the habit of going out, which they used to do regularly, disappears, it gradually becomes more and more troublesome to leave the house. Because of things like this, as dementia progresses, the opportunities to go out decrease. And as I'll talk about in the treatment section, there is data showing that maintaining connections with various people by going out helps slow the progression of dementia. So if someone stops going out, their dementia will progress even further. And if they stop going out even more, it becomes a vicious cycle, so it's really important to put a stop to this. Maintaining connections with society is extremely important. Here is the 6th early symptom of dementia: becoming easily angered or more suspicious. Please don't just simply remember that people with dementia become easily angered. It's important to think about the process and why this happens. When someone develops dementia, they worry about staying sharp and become more concerned about others. And then, they start to feel anxious inside, wondering if their dementia might be getting worse. However, if the people around them don't understand and say things like, "Mom, I already told you earlier, didn't I? You already had breakfast," or "Don't lose things all the time," it can be difficult. That anxiety turns into frustration. They start to feel, "My daughter doesn't understand me at all." When that frustration builds up, it can turn into irritability or anger. Can you understand that? And if the people around them still don't understand, that frustration eventually turns into suspicion. They start to think, "This person is my enemy, they're trying to make me suffer. This person is always being mean to me." As these experiences pile up, they lose the ability to trust others. So, depending on the environment around them, it's possible to resolve things like irritability or becoming overly suspicious. However, dementia care and nursing are really difficult. Even if you try your best and are very devoted, there are still times when you just can't help but get angry or suspicious. So, when these symptoms appear, please don't always assume it's because the support around them isn't good enough. There are many times when things just don't go well, and that's why there are specialized forms of care. Let's keep learning about them until the end. Now, in the third period, I will introduce screening tests to help determine whether dementia is likely or not. The first is a test called the finger imitation test. This one is simple. If you want to try it, let's do it together. Please imitate what I do. First, make an OK sign with both hands. Next, make a fox sign with both hands. Did you do it? Then, for the next step, reverse the fox sign and bring the ears together. And finally, rotate your right hand 180 degrees and bring the fox's ears together again. How did you do? Make the OK sign, make the fox, reverse and bring the ears together, then rotate your right hand and bring the ears together again. If you are able to do this movement, the possibility of dementia is quite low. The reason is that when you have dementia, the parietal lobe, the part of the brain responsible for spatial understanding, declines. So, things like reversing or rotating, understanding this kind of space. These movements become difficult. However, just because you can't do them doesn't necessarily mean you have dementia, so please keep that in mind. And it's fine to try it yourself, but please don't make your family members do this to check if they have dementia. Of course, if someone wants to do it voluntarily, I think that's fine, but forcing people to do it without thinking could hurt their self-esteem, or even it could damage your relationship with them, so please be careful about that. Instead, there's a simple and more detailed test called the mini-cog test. You'll need paper and a pen for this test, so I'd appreciate it if you could prepare them as you watch this video. As for what kind of test it actually is, I'm going to say 3 words now. I'll ask you these words again later, so please remember them. Sakura, Neko, Densha. Now, for the next task, please draw a picture of a clock showing 11:10. Where would the second and hour hands be? If you're following along, pause the video and draw them. Now, for the last task, the words I asked you to remember at the start. Please try to recall the 3 keywords. If you can't answer all 3 of these final keywords, or if you couldn't draw the clock and you could only answer 1 or 2 of the last questions, then the possibility of dementia is a little higher. But let me say this again, not being able to do these does not mean you have dementia. If you are able to do these, the possibility of dementia is lower, so I hope you understand that there are tests like this. Now, in the fourth period, I will explain what kinds of treatments for dementia are currently being used and whether they are truly effective. I think there are quite a few surprising points in this fourth period. What is still commonly used in Japan, the medications for dementia are called cholinesterase inhibitors. In terms of drug names, these include Aricept, Donepezil, and rivastigmine, among others. These are called anti-dementia drugs and are used for treating dementia. Many people believe that taking these medications will cure dementia or stop its progression, but that's actually not the case. The medications currently in use. These dementia medications can't be expected to have significant effects, and even if there is some effect, it's not something that a third party would notice and say, "Wow, there's been a big improvement in cognitive function." In fact, because the effects are rather limited, in some countries like France, these medications aren't even covered by insurance. That's understandable because in the case of Alzheimer's type dementia, there are things like tau proteins and amyloid beta, which are like waste products inside the brain cells. It's believed that the buildup of these substances is the cause, but these medications aren't designed to remove those underlying substances. So, since they don't actually address the root cause, their effectiveness isn't that significant. Please take a look at this graph. This is the general idea. If you don't take the medication, cognitive function declines like this, which is the typical progression. If you do take the medication, that's represented by the orange line. It looks like cognitive function improves a little, but in the end, cognitive function still declines at the same rate. Immediately after taking the medication, the cognitive function score, the diagnostic measure, improves slightly, but not enough for others to notice. Taking the medication alone, you can see that the speed of cognitive decline does not actually slow down. And furthermore, it's said that even among those who take this medication, only about 1 out of 10 people can actually expect to see this kind of effect. And furthermore, out of 12 people who take it, 1 person often suffers from side effects like nausea, diarrhea, or stomach pain. So, if the medication isn't effective, it's something that should be considered for discontinuation. In fact, in my own outpatient practice, medications can often do more harm if used excessively. If I determine that the medication isn't effective, I sometimes have patients stop taking it. And recently there have been various new medications approved for dementia, but even with the latest ones currently available, there hasn't been any remarkable. These medications haven't produced the results that people were hoping for. So for now, it's safe to say that there is no so-called miracle drug for dementia in Japan or anywhere else in the world. That might come as a bit of a surprise, so does that mean it's the end if someone develops dementia? That's not the case. Next, I'll explain what can be done besides medication to prevent dementia from progressing and also talk about the role of diet. Now, in the 5th period, I'll introduce ways to prevent dementia and methods to slow its progression. There are supplements that are said to be effective for dementia. There are a lot of functional foods out there, right? However, there is no solid research showing that these actually prevent dementia. The first group is vitamins like vitamin C and vitamin E. The second is beta-carotene. The third is things like docosahexaenoic acid and icosapentaenoic acid. Things like docosahexaenoic acid and icosapentaenoic acid. And the fourth one, which is often mentioned, is ginkgo biloba extract. The reality is that there is no solid data supporting these. However, just because there isn't data doesn't necessarily mean they have no effect. There are probably some people who have experienced benefits from taking them. I believe it's fine to take them if you trust them, since there are individual differences. However, you need to be careful about side effects from taking too much, and if you expect too much, you might end up feeling hopeless if it doesn't work. So I think it's fine to try it within a safe range, just hoping it might help. But as I've said many times, please understand that there is no objective data. So, on the other hand, what kinds of behaviors have been found in people who had a lower risk of dementia? In other words, what are the things that are more likely to help prevent dementia? The first is talking with other people, the second is regular exercise, the third is a well-balanced diet, and the fourth is having a regular lifestyle. The fifth is quitting smoking, stopping tobacco use. The sixth is drinking in moderation, cutting back on alcohol. The seventh is properly controlling your blood sugar and blood pressure. The eighth is improving periodontal disease. The ninth is improving hearing loss. What do you think? Things like diet, exercise, blood pressure, tobacco, and alcohol? There's nothing here except things that are generally said to be good for your health, right? I think many of you might be disappointed thinking, is that all? Even when you go to the hospital as an outpatient and the doctor tells you to exercise or stop overeating, I think many people feel that if it were that easy, they wouldn't be struggling. What I want to emphasize here is that you need to be careful with people who say extreme things, like if you just take a certain substance, you won't get dementia. If something like that really existed, it would be prescribed to everyone at the hospital. So I think it's also important not to be fooled by extreme information. Let's take a look at each one. I'll explain about conversations with others later. And as for exercise, it's recommended to do moderate intensity exercise about 3 times a week for around 30 minutes each time of aerobic exercise that makes you a little out of breath. However, it's pretty tough to actually exercise for 30 minutes 3 times a week, isn't it? To be honest, I myself am not able to do it 3 times a week, so even just 10 minutes once a week is fine. Just try going for a walk. Walk for 5 minutes and then walk back for 5 minutes. Even that is enough. Those small steps, one by one, gradually build up into a habit. And when it comes to exercise, there is data showing that even just walking 2,000 steps a day, about a 10-minute walk out and a 10-minute walk back can reduce the risk of clogged arteries in the heart. So don't set your goals too high. Even just 20 minutes is fine, whether it's doing something you enjoy or just taking a walk. Try to keep this mindset and give exercise a try. I've explained specific amounts of exercise and recommended exercise methods in this video, so please check it out from the description below. And third, a well-balanced diet. In fact, it can lower the risk of dementia and prevent the blood vessels in your heart from getting clogged. There's actually a magical diet that can lower these risks and even reduce the risk of death itself. That's the Mediterranean diet. Some of you might not be familiar with it. The Mediterranean is a sea in Europe. Countries like Italy are located along it, and the diet I'm talking about is the one practiced in this region. It's more about eating fish rather than meat or dairy products. For example, eating salmon as well as vegetables, fruits and nuts. And also beans, making sure to include legumes in your diet. When it comes to oil, instead of regular salad oil, you choose olive oil. There is data showing that following this kind of Mediterranean diet can lower the risk of dementia. And the Mediterranean diet doesn't just do that. There's even data showing it lowers the risk of certain cancers, like breast cancer. It's really been getting a lot of attention lately. However, eating more fish and beans is actually similar to the Japanese diet, right? So it's really not that difficult to do. If you want to see the actual diet plan, please click the official LINE link in the description. Then add us as a friend and send a chat message saying Mediterranean diet. For those people only, I would like to send the Mediterranean diet method as data, so I look forward to your registration. We also share the latest medical information and more on our official LINE. It's completely free, so please check it out. And I think it's well known that other preventive measures include quitting smoking and cutting back on alcohol, and controlling things like blood sugar and blood pressure is also important for preventing arteriosclerosis. The cause of dementia is what's called vascular dementia, which occurs when small strokes accumulate due to arteriosclerosis in the brain. There is such a thing as dementia. That's why it's really important to manage things like blood pressure and blood sugar. I've put together videos about blood pressure and diabetes here, so please check them out if you're interested. And as for other prevention methods, isn't periodontal disease a bit unexpected? Actually, just having periodontal disease can cause inflammation in your teeth. And that inflammation causes inflammatory cytokines to circulate through your bloodstream and affect your entire body. Because of this, it's believed that the risk of dementia increases. So if you want to prevent dementia, you actually need to take care of your dental health as well. So what should you actually do about your blood pressure? My blood sugar just won't go down. I'm worried about dementia in my family, and so on. I'm sure you have all kinds of health concerns. At YouTube Medical University, we hold regular live streams every Tuesday night at 9 p.m. During that time, we address your health-related concerns and provide a place to talk about your own health. We look forward to seeing you, so please feel free to join us. And what I want to emphasize most for preventing dementia is, as I mentioned at the beginning, having conversations with other people. I have a question for everyone. You go to an exercise club, but in reality, you hardly exercise at all. Between people who go to an exercise club but just chat with others, and those who don't go to group activities but work out diligently on their own, which group do you think has a higher risk of needing nursing care in the future? In fact, there is data showing that people who exercise alone and quietly have a higher risk of needing care than those who just chat without exercising. Isn't that surprising? Exercise is important, but just as important, or even more so, is interacting with others and staying connected to society. Actually living alone, having little contact with others and lacking support from those around you are said to increase the risk of developing dementia. And on the other hand, being connected to society and feeling a sense of purpose in life, having something that makes life worth living. There is also data showing that people like that have a lower risk of developing dementia. In other words, being connected to society and having your own role, living with a sense of purpose is also good for preventing dementia. And that impact is even greater than whether you smoke, drink alcohol, have an exercise habit, or are overweight. It's said to affect your lifespan. Of course, it's important to be careful about lifestyle diseases or to quit smoking, but are the people around you living with a sense of purpose? I think paying attention to that will become even more important in the future. Now, in the sixth period, I'd like to talk about important perspectives on dementia going forward, as well as my own thoughts. I've explained that there are things you can do to help prevent dementia. Of course, by practicing these things, I believe you can prevent or at least delay the onset of dementia. And I also want to keep this in mind, but the reality is that by the age of 90, 60% of people will develop dementia. If you think about what happens when you reach 100 as everyone gets older, the possibility of developing dementia becomes extremely high. No matter who you are, as you age, you might eventually develop dementia. In other words, instead of thinking that it's the end if you get dementia, you should consider what to do if you develop dementia in the future. How can you continue to live true to yourself even if you develop dementia? And if someone around you develops dementia, how can you support them so they can continue to live in their own way? I think it's important to consider these things. As I mentioned earlier, the things that are said to help prevent dementia, like diet, exercise, and blood pressure, are all things that ultimately just help you live longer. And now we live in an era where people say life lasts 100 years. So while it's important to try to prevent dementia, it's also important to be prepared in case you do develop it. Please remember that. We keep thinking, don't get dementia, don't get dementia, don't get dementia. If you become too obsessed with this way of thinking and try too hard, when you actually start to develop dementia, you might end up feeling hopeless, thinking, oh, I'm done for. Isn't it possible that a society that thinks this way is actually making it harder for people with dementia to live? If you develop dementia, well, it can't be helped. Even if you develop it, things may go well if you approach it this way. Being able to think like this is important. Let me introduce a way of thinking about disabilities. When you develop dementia and your brain function declines, your cognitive abilities decrease, leading to memory impairment, disorientation, as I mentioned earlier, and difficulty performing complex tasks. Those kinds of impairments appear, and due to these brain function impairments, eventually problems in daily life will arise, right? Like not being able to go shopping, not being able to travel far, or not being able to cook. Trying to prevent this decline in brain function is what dietary methods to prevent dementia are for, or, although the effect is slight, dementia medications as well. Trying to solve the root cause like this is what's called the medical model. On the other hand, let's try to do something about the daily life problems caused by those brain function impairments. Approaching that is the idea behind the social model. If you think about it carefully, as cognitive function declines, not being able to use a self-checkout register is because there are only self-checkout registers? Doesn't that mean that person can't shop? Isn't the reason they can't withdraw money because all the ATMs have become unmanned? In other words, the obstacles in that person's life aren't just that person's fault. Obstacles in daily life arise through interactions with society. In other words, if we can design society to be easier to live in, even for people with dementia, the obstacles in that person's life could be reduced. For example, if someone develops a tumor in their bone and has to have one leg amputated, let's say that person ends up in a wheelchair. If they want to go up to the second floor but there are only stairs and they can't get up, if we try to solve this disability using the medical model, it would mean providing the person with a prosthetic leg and training them to walk. On the other hand, if we try to solve it using the social model, we would add a ramp next to the stairs so that a wheelchair can go up, or provide an elevator. That would be the solution according to the social model. If there had been a ramp or an elevator from the beginning, that person wouldn't have had any obstacles in their daily life, right? As I keep saying, the disability is not the person's fault, but something that arises from their relationship with society. In other words, when someone develops dementia, they can get lost in places. It's not that they shouldn't go outside because they might get lost, but even we get lost when we go to unfamiliar places, right? We get lost when we travel abroad, don't we? At times like that, we use things like smartphones and maps, relying on all sorts of tools to overcome those obstacles to our actions. So, what can we do to help people with dementia avoid getting lost? For example, we can make the text on bus schedules larger or provide audio announcements. Nowadays, AI robots might also be helpful. By addressing each of these issues one by one, we can make life easier even for those with dementia. I think it's important to create a society like that. And such a society would be kind to people with dementia, and maybe even easier for foreigners to understand. We all get lost sometimes, so it would make it less likely for anyone to get confused. In other words, it would become a society where everyone can live more comfortably. This person has dementia, this person doesn't. Let's treat people with dementia differently. Let's put a global positioning system on people with dementia so they don't get lost. Dealing with dementia by making such distinctions. Do people with dementia really want a society like that? Whether someone has dementia or not, we should be able to live together and coexist. I believe we should build a society where everyone can live fully and authentically. Labeling someone as dangerous or bad because they have dementia is wrong. Instead of that, we should first ask, what kind of life has this person lived before developing dementia? What do they like? What are they not good at? What gives their life meaning? Not everyone likes coloring. Some people enjoy tinkering with fishing gear, some like knitting, some like reading. There are all kinds of people. I believe it's important to offer care tailored to each person and help them find meaning in life. That's the kind of care that truly matters. I have created a space in the community called Hakodate Kurashi no Hokenshitsu, where we as healthcare professionals go out into the town and chat with people over tea, coffee, and snacks. People drop by casually, thinking it looks like fun, have a chat, and then go home. Before long, we started having regular visitors, and then those regulars started bringing their friends, which led to more interactions with new people. Their friends would share their worries with us, and as our relationships deepened, people began to open up about the concerns they had been carrying. They would open up about painful experiences from their past, and as a result, their hearts felt lighter. All kinds of positive changes started happening. There was also a husband who came together with his wife who has dementia. In that community health room, we also discussed together how to provide care so that people can live happily. This is called person-centered care, where the people around focus on caring for the individual. We pay attention to who that person is and what gives their life meaning. I think efforts like these should be given more attention. I might have been too passionate, but now, for this last 7th period, I will introduce some important caregiving principles that I want families of people with dementia and those involved in caregiving to know. Here is the first of 3 important principles for dementia care. Value the why. For example, let's say there is someone who repeatedly asks the same question, as I mentioned earlier when talking about the early symptoms of dementia. Hey, is breakfast ready yet? An hour later. Hey, when is breakfast? Another hour later. Aren't you going to make breakfast for me? Instead of getting upset and repeating, I already made it, try thinking, if they're asking this much, maybe they're hungry. With this mindset, you can simply respond, oh, you're hungry, aren't you? Then, how about I bring out some snacks and we have some tea? Sorry to trouble you, but could you make some tea for us? You might be able to shift the conversation like this. That way the person might think, oh, we're going to have some snacks, and then feel a bit distracted and decide to go make some tea. In other words, people with dementia aren't acting without any reason or understanding at all. I like to call these kinds of actions challenge behaviors. When we struggle with someone's actions who has dementia, it's because they're trying to communicate something. That's how I want us to view it. When I was on night duty as a doctor, a nurse on the ward said to me, Mr. XX in room XX just won't sleep at all. In fact, he wanders the ward, and when we try to return him to his room to sleep, he gets upset. The nurse asked, Doctor, please do something. When I actually rushed over, sure enough, he was walking around the ward. This is probably what the nurse was referring to as wandering. Even if you bluntly tell the patient to go back to their room and sleep, they might refuse. So why is that? Was that person really wandering? I think what's important is to have a conversation. When I asked Mr. XX, why are you walking right now? He replied, why? Isn't this normal? Actually, that person used to work as a building manager, so for him, he wasn't really wandering around the hospital, he was just doing the job he used to do. This kind of thing happens a lot. People with dementia sometimes live as if they are in the time when they were at their best. So, when you ask them how old they are now, even someone who is 70 might answer, I'm 35. And even if they forget the faces of their current family, when they see old family photos, they might remember and say, this is my daughter. For that person, they're not wandering around the hospital, they're trying to accomplish their work. When I realized that, I said, thank you, Mr. 00. Today is your day off, so please go back to your room and get some rest. I told him that, and he understood and went back to his room. Please try to have conversations and find out the reasons behind such actions whenever possible. Here's the second of the 3 key points for dementia care. You don't have to forcefully correct them. This is to protect the caregiver's own well-being. We're only human, not gods. Of course, it's impossible not to get irritated sometimes. When caring for someone with dementia, even if you try your best to be patient, you might still get irritated or feel sad when you realize you're irritated. There are honestly a lot of tough moments like that. Sensei, I don't know if I can keep caregiving anymore. How many years will this situation go on? I get asked things like this too. Like I said earlier, you don't have to say, you already had breakfast. You can just say, oh, you haven't had breakfast yet, have you? Then let's have a snack. Even if they've already had breakfast, you can just go along with it as if they haven't and get through the moment that way. I think that's one way to handle it. And then there are cases of delusions like thinking someone has stolen something, where they might say, you took my important wallet, didn't you? Even though you always take care of them with such devotion, it can be hurtful to be suspected like that. However, it's actually because they trust you the most and because you usually manage their wallet that they end up suspecting you. If you get angry and say, no, I didn't take it, it can quickly turn into a heated argument. You don't have to force yourself to correct them in those situations. Even if you're being suspected, just say, so it's missing for now. Acknowledge that the wallet is currently missing. If you keep arguing about whether you took the wallet or not, you'll just end up facing off against each other. If you keep fighting like that, you'll just wear yourself out. Instead, try to steer the conversation so that you're both facing the same direction, like saying, let's look for the wallet together. I think this is also a useful technique. And when you find the wallet, instead of saying, see, it was right here, try to be a bit smarter. Even if you know where it is, suggest, why don't you check over there, and let them find it themselves. This way, you can avoid accusations like, you knew where the wallet was all along, didn't you? There are similar techniques. If you're struggling with something, share it in the comments. Here is the third tip for dementia care. With some creativity, you can stay connected to society. Some believe dementia means you'll get lost and can't do anything. Some say it's bad because you could make money calculation mistakes. They keep repeating it's no good. Mom, don't do that anymore. Mom, it's dangerous, so don't do that. Cooking is dangerous because of the fire, so don't cook. I completely understand the feeling of wanting to set these kinds of restrictions. However, losing connections with society actually accelerates the decline in cognitive function, right? So instead of saying don't go to new places, it's more important to go together until the person gets used to the new place, or to use some kind of service like getting help from a helper. Building connections with society before dementia progresses until the person gets used to it is actually what's really important. And there will be times when the person themselves feels it's too much trouble and doesn't really want to go out. For example, when you're working. If your mother is going to day service, she might forget that her day service is every Wednesday, or she might not realize that today is Wednesday. She may not be ready or dressed to go out. When day service staff arrive, she often says, I'm not ready today, so I won't go. And this has been happening more frequently. So, how should we handle situations like this? For example, you could buy a small whiteboard at a dollar store and write, today is Wednesday, so it's day service. Just writing a simple note and leaving it out might help her remember that today is day service, so she could get dressed and wait. Even just marking the calendar with a big red circle might solve the problem. Disabilities are shaped by the relationship with the environment, right? So let's try to think about whether changing the environment could help things go more smoothly. If you have any tips or things that worked well for you, please share them in the comments section. Sometimes your wallet might get stuffed with coins, or you might accidentally leave without paying, and then feel like you can't go anywhere anymore. For example, let's say someone has a routine of going to the public bath, enjoys talking with people there, getting clean, and then taking a walk home. If they struggle at the register and lose confidence, they may say they don't want to go anymore, even at familiar places. If it's a public bath, you could ask the owner to let you pay in advance so you can keep going without any problems. Public baths also have coupon tickets, right? So you could buy a bunch of those and give them to the person. If you tell them, use these to go to the public bath, they might be able to keep going without any problems. This is also a kind of ingenuity. Why not think about what kind of creative solutions you can come up with to help maintain connections with society? These were 3 important tips for caregiving. Finally, let me share with you one more fundamental and essential idea about caregiving. That is to value emotions. People with dementia don't forget absolutely everything. In fact, it's said that emotional stimulation tends to remain in the brain. So, if you get angry at people with dementia for everything, even if they don't remember being scolded, the emotional impact of being scolded is engraved in their brain. Negative emotions like anger, anxiety, and sadness remain in the brain. Because of that, when the person comes again, they remember those negative emotions and end up taking it out on others, getting angry or becoming suspicious. When that happens, the care you give keeps getting worse, doesn't it? So, as a caregiver, please always keep in mind that the person still has those emotions in their heart. For example, if you leave the kettle boiling and it causes a fire, that's dangerous, right? If you say things like, "Why did you use the stove? You can't use hot water anymore, you forget everything." From their perspective, being spoken to like that, even if they don't remember, the negative feeling of being lashed out at by their daughter remains. As a result, they might start to dislike their daughter and think, "I can do everything by myself," and become rebellious. But instead, when the kettle was left on and it was dangerous, "I want you to live a long life, Mom. That's why, even though I don't want to say it, I really want you to avoid using the stove. Let's try saying, 'Thank you for everything, as always.'" By doing that, your mother will feel, "Oh, my daughter really cares about me. Thank you." And those positive feelings will remain. This makes it easier for care to go well the next time you talk with your daughter. Please don't forget the perspective of leaving positive feelings with the other person. And this issue with fire is really important, isn't it? It would be terrible if there was a fire. However, no matter how many times you scold her, she might forget that she was scolded. She might think that she can cook and handle fire on her own. In situations like that, you should make adjustments to the environment, right? For example, you can shut off the main gas valve or make sure it can't be opened again. But if you do that, she might think it's strange and start fiddling with the gas valve. A recommended method is to put up a big sign saying, "The stove is out of order and cannot be used right now." That way, she'll understand that it's broken and won't try to use it. So, by making clever adjustments to the environment, you can help control her actions. How was that? This turned out to be a really long video, but thank you very much for watching until the end. If you can remember the content of this video well, you'll be able to understand dementia in as much detail as a medical professional. I've packed this video with my thoughts and important knowledge I've learned in clinical practice. Please let me know your impressions or thoughts in the comments section. And if you think the video is good, I would be really happy if you could press the like button. This time, I'll talk about what kind of illness dementia is, its early symptoms, how to check for dementia, treatment methods, and prevention methods. And most importantly, it's essential to create a society where people with dementia can live more comfortably. I also introduce perspectives on dementia care. At YouTube Medical University, we provide fun, easy to understand and responsible videos from a doctor's perspective to help you become healthier starting tomorrow. With the rise of the information society, all kinds of medical information have become readily available. While much of it is useful, some of it is incorrect. To avoid regretting acting on such information, it's important to make sure you get information you can trust. If you like this, I'd really appreciate it if you could subscribe to the channel so you don't miss any new videos.